Staying active is crucial for maintaining physical and mental well-being as we age. But it's essential to choose exercises that are safe and appropriate for seniors. Gentle, low-impact, all-in-one exercises can help seniors improve their strength, flexibility, balance, and overall fitness without putting undue stress on the body. Here are some exercises designed with seniors in mind. Seated marching. Sit in a sturdy chair with your feet flat on the floor. Lift one knee toward your chest and then lower it. Repeat with the other knee. Continue this marching motion for 1 to 2 minutes to warm up and improve circulation. Chair squats. Purpose. Chair squats are a low-impact exercise designed to strengthen the muscles in your legs, particularly your quadriceps, hamstrings, and glutes. This exercise also helps improve balance and mobility, making it easier to perform everyday activities like standing up from a chair or getting out of bed. Begin by standing in front of a sturdy chair or a similar stable surface, such as a countertop or a bed, with feet hip-width apart. Make sure the chair is positioned so that it won't move while you're doing the exercise. For the posture, stand up straight with your chest lifted, shoulders relaxed, and your core engaged. Keep your arms at your sides or extend them forward for balance if needed. Squat down. Slowly lower your hips back and down as if you're about to sit in the chair. Keep your weight on your heels and imagine reaching your hips back behind you. Your knees should stay aligned with your toes and your back should remain straight. Try to keep your chest up throughout the movement. Lower gently. Continue lowering yourself until your buttocks lightly touch the chair. It's important not to plop down, but instead make a controlled touch. Stand back up. Push through your heels, engage your leg muscles, and stand back up to the starting position. Imagine using your leg muscles to lift you rather than pushing off the chair. Repetitions. Perform 10 to 15 chair squats to start, or as many as you are comfortable with. As you become more comfortable with the exercise, you can gradually increase the number of repetitions. If you find it challenging to maintain balance, you can hold on to the chair lightly for support. As you progress, try to rely less on the chair for balance. Keep your movements slow and controlled to prevent any sudden jerks or strains. Focus on your breathing. Inhale as you lower yourself down and exhale as you stand back up. Pay attention to your form, ensuring that your knees don't extend beyond your toes during the squat. As you become more confident and stronger, you can increase the depth of your squats, gradually lowering yourself closer to the chair. Standing leg raises. Stand behind a chair for support if needed. Lift one leg straight out in front of you, keeping it as straight as possible. Lower it back down. Repeat with the other leg. Perform 10 to 15 leg raises on each side to work on balance and leg strength. Wall push-ups. Stand facing a wall at arm's length. Place your palms on the wall at shoulder height. Lean toward the wall, bending your elbows as you bring your chest closer to the wall. Push back to the starting position. Do 10 to 15 wall push-ups to strengthen your chest, shoulders, and arms. Seated toe taps. Sit in a chair with your feet flat on the floor. Lift your heels and tap your toes on the ground. Alternate tapping your toes for 1 to 2 minutes to improve circulation and ankle mobility. Arm circles. Arm circles are a simple yet effective exercise that helps improve shoulder flexibility, range of motion, and strength. This exercise can be especially beneficial for seniors as it promotes upper body mobility and can be done while seated or standing. For the setup, stand up straight with your feet hip-width apart, or sit in a sturdy chair with your back supported and your feet flat on the floor. Keep your posture tall and your core engaged. For the position, extend your arms out of the sides, parallel to the ground. Your palms should be facing down. Ensure that your arms are fully extended, but keep a slight bend in your elbows to avoid locking them. Begin arm circles. Start by making small, gentle circular motions with your arms. Keep your circles controlled and deliberate. You can choose to rotate your arms forward or backward depending on your preference. Gradually increase size. As you become more comfortable with the motion, gradually increase the size of the circles. This will engage a wider range of motion in your shoulder joints. Continue circles. Maintain a steady pace and continue circling your arms for 1 to 2 minutes. Focus on your breathing, inhaling and exhaling slowly as you perform the exercise. Reverse direction. If you initially started with forward circles, switch to backward circles or vice versa to work the muscles from different angles. Relax and lower arms. After completing the desired duration of arm circles, lower your arms back to your sides and relax. Ensure that your movements are controlled and smooth. Avoid any jerking or sudden motions. Keep your shoulders relaxed throughout the exercise and avoid shrugging them up towards your ears. You can adjust the size and speed of your circles based on your comfort level. Start with smaller circles and gradually work your way up. If you experience any discomfort or pain, stop the exercise immediately and consult a healthcare professional. If we talk about the benefits, increases shoulder joint flexibility and range of motion, helps alleviate stiffness in the shoulders which can be common among seniors, enhances blood circulation to the upper extremities, promotes improved posture and upper body awareness, strengthens the muscles around the shoulder joint. Standing calf raises. Stand behind a chair or hold onto a sturdy surface for balance. Rise up on your toes, lifting your heels off the ground. Lower your heels back down. Repeat this movement 10 to 15 times to strengthen your calf muscles and improve balance. Standing side leg lifts. Standing side leg lifts are a low-impact exercise that focuses on strengthening the muscles of the hips and thighs. This exercise is particularly beneficial for improving hip stability and balance, which can help prevent falls and maintain mobility in daily activities. Stand up straight with your feet hip width apart. You can choose to hold onto a sturdy chair, countertop, or wall for balance if needed, especially if you are new to this exercise. If we talk about the posture, keep your shoulders relaxed, your chest lifted, and your core engaged throughout the exercise. You can place your hands on your hips or let them rest at your sides. Lift one leg. Begin by lifting one leg out to the side. Keep the leg straight or slightly bend the knee if that's more comfortable for you. Lift gently. Lift your leg only as high as you can comfortably manage. The goal is not to raise it excessively, but to engage the muscles on the side of your hip. Pause at the top. Hold your leg in the raised position for a brief moment, focusing on maintaining your balance. Lower carefully. Slowly lower your leg back to the starting position, keeping it under control and avoiding any sudden movements. Repeat on both sides. Perform 10 to 15 leg lifts on one side before switching to the other leg. Start with a manageable number and gradually increase as you become more comfortable with the exercise. For the tips, ensure that your standing leg remains slightly bent at the knee to maintain balance and reduce stress on the joints. Keep your toes pointing forward and avoid turning your foot outwards during the leg lift. Maintain proper posture by keeping your spine aligned and your chest upright. Focus on controlled movements rather than speed. It's more important to perform the exercise correctly than quickly. As you gain strength and balance, you can increase the number of repetitions and leg height. Strengthens the muscles around the hips, thighs, and buttocks, helping with stability and balance. Improves hip joint mobility and flexibility, enhances coordination and proprioception, awareness of your body's position in space. Can help prevent hip injuries and falls, which are common concerns for seniors. Supports functional movements like stepping and lifting the leg in daily activities. Seated trunk rotation. Sit in a chair with your feet flat on the floor. Hold your arms out in front of you. Twist your upper body to the right, then to the left. Continue this rotation for 1 to 2 minutes to improve spinal mobility. Deep breathing and stretching. Finish your exercise routine with deep breathing and gentle stretching to improve flexibility and promote relaxation. Always consult with a healthcare professional before starting a new exercise program, especially if you have any medical conditions or concerns. Start slowly, listen to your body, and gradually increase the intensity and duration of your workouts as you become more comfortable with these gentle exercises. Staying active is a safe and enjoyable way is essential for maintaining health and independence in your senior years.